Globally, 1 in 6 people is affected by infertility, says a report by the World Health Organization. In India, about 34 million people suffer from infertility, and this has meant a spike in demand for in vitro fertilization. But costs are prohibitive. IVF treatment can cost between 2 to 3 lakh rupees, and the success rate is only 40 to 50%. People looking at IVF treatments have also to deal with the fact that the treatment is not covered under any insurance scheme offered by large companies. There is just one company, Safety Insurance, that offers such a cover in collaboration with Indira IVF. There is no government scheme offering support either. The medical community hopes the finance minister will use this interim budget to provide some relief.
Budget always caters to, all the rest of the population, which is like, anemia, diabetes, the lifestyle diseases, the obesity, etc. Budget wish list is really very simple. I want, let's look at the WHO data, the WHO guideline, which says infertility is a disease. 17% of the population is affected with it. So I want the government to allocate this as a disease, give it some budget, and give it a recognition, and include it in, in its programs, because if it should be encouraged as a treatment for a common person, and it should be available to the common people, I think IVF should be included. I think what we need is some kind of an insurance coverage which will help the patients, because what will happen is the insurance coverage, the insurance policies will definitely help patients in many ways. Like it'll give a financial relief, it'll increase the affordability of IVF.
The government had successfully passed the Artificial Reproductive Technology Bill in 2023 to regulate the standards of these artificial methods of reproduction. However, patients do not have any financing option, and IVF treatments can be a drain on savings with no guarantee.
The government has just recently introduced the ART bill 2 years back, which is a good step in terms of regulating the overall industry. Now, as the regulation is going forward, more proactive steps need to be taken to include it in the insurance sector, to provide co-payment options. Many countries have co-payment options where patients would pay 50% of the cost and 50% is borne by the government there. So I think co-payment options, a lot of financing options, insurance, and developing all the R&D and infrastructure facilities, that should be on the cards, which would help the industry take the right step.
With infertility proving to be a serious concern for India, experts believe recognition of the situation and appropriate budgetary and government aid to make it more accessible and affordable are the need of the hour. In Mumbai, Rumi Chakraborty.
For more news and updates, all you need to do is follow CNBC-TV18 on all of our digital platforms.